So, without further ado, we're going to move forward to our first speaker this afternoon, and I'm really pleased to welcome a guest speaker from OHRP, Jaime Hernandez. So Jaime Hernandez is an attorney and bioethicist who is currently a public health advisor with the Division of Education and Development at the Office for Human Research Protections, or known as OHRP affectionately to us. Before joining OHRP, Mr. Hernandez was a senior research investigator at the University of Pennsylvania in the Department of Medical Ethics and Health Policy. Prior to that, he was a litigation associate with Hughes, Hubbard & Reed. He also served as an administrator for the Social and Behavioral Science IRB at the University of Pennsylvania in their Office of Regulatory Affairs. Mr. Hernandez obtained his JD at the University of California, Berkeley School of Law, and his master's in bioethics at the University of Pennsylvania. He also holds a bachelor's in philosophy from the University of Miami. And this afternoon, Jaime is going to be speaking on what you should know about IRB review of research.
Great. Good afternoon, everyone. Thank you, Dawn, for the introduction. And I'm sorry, I've been given the responsibility to keep you awake after lunch while we talk about ethics. It's not easy, but I'll do my best. In discussing what you should know about IRB review, the first thing that I wanted to address is why do we need IRB review? During the late 60s and early 70s, there were a lot of public scandals that resulted from the media publishing things that scientists were doing to people in the name of medical progress. Some of these are pretty famous, such as, for example, the Willowbrook hepatitis experiments, where healthy children were being injected with the hepatitis virus. There was also the Stanford prison experiment, where undergraduate students were assigned to play roles of prisoners or prisoner guards. And soon after the study commenced, there were the roles were taken too seriously, and there was a lot of abuse of the prisoners. And then, of course, there was the Tuskegee syphilis studies that were very poor rural African-American men who had syphilis. The researchers actually withheld the cure for syphilis for many years, I'm talking 30, 40 years, in order to study the natural progression of the disease. Now, keep in mind that none of these experiments were an evil scientist trying to take over the world. And also, these experiments were not Nazi experiments. These were not evil people. These were good scientists trying to do good science for the progress of humanity. But in doing this, the scientists were overlooking the harms and overestimating the benefits of their own work. And it became obvious that scientific self-regulation didn't work. What was also very scandalous at the time is that most of this research was either conducted or sponsored by the federal government, by the United States. This, of course, gave Congress the green light to be able to regulate the conduct of human subject research. In doing this, Congress in 1974 passed the National Research Act, which established the National Commission for the Protection of Human Subjects in Research, or the National Commission for short. The National Commission in 1979 published the famous Belmont Report. The Belmont Report outlined basic ethical principles for the use of humans in research, in scientific research. In 1981, Congress acted again and enacted the regulations under 45 CFR 46. They're called the Regulations for the Protections of Human Subjects, which is the rules or the regulations as we know them today. It is key to understand IRB and to understand these regulations, that these regulations, what they did was adopt the Belmont Report almost entirely. The Belmont Report, as I said, outlined the basic principles for the conduct of human subject research. For example, respect for person, which beneficence and justice. In adopting the Belmont Report, the regulations took respect for person and implemented the requirements for informed consent, protecting the autonomy and the voluntary participation of the subjects. The regulations took the principle of beneficence and turned it into minimizing the potential risk to the participants and a favorable risk and benefit analysis. And they took the principle of justice and they turned it into the equitable subject selection and an equitable distribution of benefits and burdens from the resulting from the study. In addition to adopting these basic principles for the conduct of human subject research, the regulations also established the requirement for IRBs. IRBs, or Institutional Review Boards, are committees based on every institution that receives federal funds for research, and it reviews the initial conduct or the initial submission of research involving human subjects. It does this through an expedited or a full board mechanism, of which we're going to talk about in a few minutes. But also the IRB is responsible for overseeing the ongoing conduct of research. So not only does the IRB reviews and ensures compliance with the regulations before the research starts, but it also oversees the ongoing compliance by continuing review every year, usually, review of the protocol modifications or amendments, anything that changes the protocol or changes the risk level of the study needs to be submitted to the IRB on an ongoing basis, and also adverse events, tracking and reporting adverse events to OHRP. But what requires IRB review? Not everything that looks like research or is research requires IRB review. Like Misty mentioned earlier in her morning presentation, the first question that we ask ourselves is whether the activity that we are considering is research. If it is not research, the regulations don't apply. If the activity is research, then we ask the second question, does it involve human subjects? If it doesn't involve human subjects, again, the regulations don't apply. If it does involve human subjects, however, we ask ourselves whether it qualifies for exemption. These exemptions are a few categories that the regulations exempt from its applicability. In other words, the rationale behind these exemptions is that if the research meets the criteria for one of those exemptions, it's considered to be low risk enough that the regulations for the protection of human subjects shouldn't apply. So if the research is exempt, then the regulations again don't apply, which in practice, it is often the IRB the one making the determination of exemption. And this is because the criteria is not very easy to apply. So many institutions, and definitely this is the practice that OHRP also recommends, even though they're not required to look at exempt research, they prefer to be the ones making the exempt determination and not the scientists. But if the research is not exempt, if we have an activity that is research, that it involves human subjects, and that is not exempt from the regulations, then IRB review is required. This initial IRB review will be done through one of two mechanisms, the expedited mechanism or the full board, or also called the full committee mechanism. Qualifying for expedited review, excuse me, the difference between the two is really an issue of timing. When you qualify for expedited review, the protocol is going to be reviewed by an experienced reviewer, and it often leads to a quicker turnaround that if you have to submit to the full committee where many people would read your protocol, will discuss it, and often you have to wait until the committee meets. So the only difference between the two is that expedited, as the name implies, may be a bit faster. and you qualify for expedited review, if the procedures in your research are listed under a list of categories that is attached to the regulations, and your study is also minimal risk. Note that if the procedures in your study are included in the list of categories, and your study is not minimal risk, you're not going to be able to qualify for exemption. For expedited. Both of these have to be complied with. Full board review will take care of everything else that is, again, human subject research, but more than minimal risk of procedures that are not listed in that addendum. Note, however, that the IRB requirements for approval are the same whether your study is being reviewed through the expedited or the full board mechanism. This includes the criteria for approval and the requirements for informed consent. Which leads us to the question that everyone asks. This is possibly the question that we get asked the most. How to pass the IRB? I don't like that question. If you look at the definition of the verb to pass, according to dictionary.com, it means to move past, to let go without attention, to leave unconsidered, disregarded, or overlooked, to go through or beyond a barrier, to endure or undergo. And this is not the purpose of the IRB. The IRB is not there as an obstacle to your research. The IRB is there to protect the safety and the rights and the well-being of the humans that are participating in that research. The IRB seeks to strike a very difficult balance between this protection of human subjects and promoting the advancement of research. If we want to do research very fast, if we do research without any ethics, we will definitely get scientific results faster. But if we look at Nazi Germany, that's a very good example of what happens when you do research without ethics. There is a human cost to that. And that human cost is precisely what the IRB tries to avoid. So if we keep the IRB, if we look at the IRB as the institutional body in charge of striking that balance between the progress in science and the protection of the human participants, then we shouldn't ask how to pass the IRB. A better question should be how to write an effective IRB submission. This implies a protocol submission that proposes a research that is as ethically sound as it is scientifically sound. So if the question is how to write an effective IRB submission, the answer is already in the regulations. The regulations under section 46.111 give you the complete criteria for initial IRB approval of research, including that the risks to participants are minimized, that the risks are reasonable in relation to the anticipated benefits, that there's an equitable selection of subjects, that when appropriate, there's a data safety monitoring committee. When appropriate, the privacy and confidentiality of the data is protected. And in today's world, privacy and confidentiality is almost an issue it's an issue in almost every single study these days. It also requires that additional safeguards are implemented for participants that are likely to be vulnerable to coercion or undue influence. And it requires the informed consent of each prospective participant and that it is also documented. Remember, like I said earlier, this initial IRB criteria for initial IRB approval of research applies equally whether your study is being reviewed by an expedited or full board mechanism. But how do we translate this legal jargon into a research proposal that satisfies the requirements that we had in the slide before? The answer is not a secret. You already have a roadmap or a guide on what the minimum requirements are for your study to satisfy the IRB requirements. If you already have a roadmap, then what is left is nothing but an exercise in good writing. First, you should write for an experienced reviewer. And by inexperience, I don't mean inexperience in reviewing protocols. I mean that reviewer is inexperienced in your particular discipline or specialty or field of work. Keep in mind that an IRB committee requires to have at least one member that is a non-scientist. And also it's required to have at least one member that is not affiliated with the institution. This member may or may not be a scientist. Keep these people in mind when you write your protocol. Keep in mind that you're writing to not scientists, to people. Don't assume that they are familiar with the background or the jargon of your own specialty. Second, organize your writing and use headings, use subheadings. This sounds pretty standard of an advice, but the person reviewing your protocol is likely to have another 5 to 10 protocols to review. And if your protocol is disorganized, it's going to go into the pile that requires additional attention. It's not going to go into the direct approval pile. Leave no loose ends. Anticipate questions from the reviewer and answer them. Submit a complete protocol. Include all the instruments, all the surveys, and all the measurements that you're going to use. And don't just copy and paste. If you copy and paste, you may end up with information that used to make sense in the document that you're copying from, but it doesn't make sense now, and that will delay your approval. Also, think through the implementation of your project at every point. If you copy and paste from perhaps a grant proposal, for example, keep in mind that when you're writing a grant, you're writing for peer reviewers in your field that are reviewing that proposal mostly through the lens of good scientific research. But when you submit to the IRB, the IRB is going to review your protocol through the lens of the protection of human subject research. So when you copy and paste, even though you are providing good information regarding the protection of subjects, you may not be providing all the details necessary for the IRB to make an approval. Let's look at this as an example. Let's say that you're writing about the equitable selection of subjects. And these are only some ideas to keep in mind when writing about equitable selection. This is by no means a list of everything that you need to know or that you need to write about. But first, explain why the subjects that you are using in your trial are the scientifically appropriate population for this study. The fact that the subjects are accessible to the investigator doesn't make it necessarily the most scientifically sound population. And at the same time, you should address not only the inclusion, but also the exclusion criteria in your study. Use different subheadings for each. Exclusion criteria, these people will be excluded. Why? Inclusion criteria, these people will be included. Why? Also address the likelihood of coercion or undue influence. This is very important because we tend to think of coercion or undue influence only when there are populations that are in some form of disadvantage. For example, if you're doing research with handicapped or demented patients, or you're doing research, for example, that regulations have a special requirements for when you're doing research with pregnant women, prisoners, or children. But many populations can be at risk of coercion or undue influence in different situations. Students may be, for example, coerced into participating in a study that the professor is conducting on them. They may think that they need to do this to get a good grade in class. Or employers may be coerced when their boss is the one recruiting them to participate in a research study. They may feel that they may lose their job or have a bad employment review if they don't participate. Coercion can even happen in healthy adults. If you pay them enough money, if you pay them a lot of money, that would be considered perhaps undue influence to participate in a research study. So coercion and undue influence come in many flavors, and it's not always in disadvantaged populations. So keep that in mind. But not just don't just mention that there's likelihood of coercion or undue influence. You should also explain what measures would you implement in your study to minimize the possibility of that coercion or that undue influence. And let's look at this in a concrete study. Let's say that we are doing a study assessing the effect of MDMA, also known as ecstasy, the party drug known as ecstasy, in addition to cognitive and behavioral therapy, CBT, to treat resilient depression. Patients with depressions that have failed to respond to conventional treatments and who receive CBT only for symptom management will be randomized to CBT only on one arm, and on the other arm they will receive MDMA therapy plus CBT. Women and patients taking SSRIs, such as Prozac, will be excluded from the study. And you're right in the equitable selection of this section. Explain why this is the most appropriate population. In this case, you can explain, for example, that these subjects have not responded to any of the conventional therapies. So it is perhaps a beneficial risk-benefit proportion to them to give it a shot with a less conventional therapy. Outline and explain the inclusion and exclusion criteria. Why are you excluding patients who take SSRIs? If there is a clinical explanation for this, include it in the protocol and cite to prior research that suggests that patients taking SSRI are excluded from the study. Also, why are you excluding women? Is it because of a pregnancy issue? Because if that is the case, you should perhaps exclude only pregnant women, or you should inform the women in the consent form not to get pregnant while they're participating in the trial. But is there any other reason why you will be excluding women? And if so, explain it in your submission. Also absent from this short description is any mention about the age of the subject. Are you using adults only? If this is an adults-only clinic, will you exclude subjects under 18? And why? And if you're going to include subjects under 18, not only now you have to comply with regulations, additional regulations, but also you explain why. Cite to prior similar studies that have been done in children that suggest that this is an appropriate population for this. Also, address the likelihood of coercion and undue influence. In this case, failure to respond to conventional treatment in the past can create undue influence on potential participants that are desperate for an effective treatment. If nothing else has worked for them, they may be too eager to participate in any clinical trial in hope for a benefit. How will you minimize this? Not just take into consideration and address that, but also address clearly in your protocol under a separate subheading. How will you minimize the likelihood of the potentiality for coercion? For example, you can work with treating physicians to ensure that potential participants are able to consent and understand that this is only an experimental treatment, that they may not benefit, that the depression may not get better. Also, this is possibly one of the most important things to keep in mind. Anticipate and address reasonable questions from the reviewer. If the reviewer is somebody not in your field, what are other reasonable questions that a reasonable person not in your field will have about this study? This may require you for a second to step out of your discipline's hat and think as a person who doesn't have your training. For example, will you exclude subjects with a history of substance abuse? This may be very obvious to you in your field of study, but a reviewer who doesn't practice the same kind of medicine or in the same discipline looks at the study that you're doing with MDMA and cognitive and behavioral therapy, and one reasonable question is, oh my God, you know, there's a higher incidence of substance abuse among people with depression. Do any of these people have a substance abuse problem? Are you going to exclude them? Giving MDMA, an additional drug that is otherwise illegal, to these subjects, would put them at additional risk? Those are all reasonable questions that a person who doesn't practice your discipline may have. Address it in your protocol. Even if you don't think it's an issue, you should anticipate them and address them. And in that way, they're answered first time that the protocol is reviewed, and there's no need to put the protocol, to withhold approval and put the protocol on hold. For example, also another reasonable question, can severely depressed people consent to participate in research, or do we need legal guardians? If you are practicing in this field, you will probably know that there's a lot in the literature about depression and consent. Address those issues. Cite to the literature ahead of time, because any reasonable person could have the question of, are these people capable of consenting? Let's look at another example, this time if you're writing about minimizing the risk to subjects. Identify first the study interventions. The only thing that you are required to minimize by the regulations is minimize potential risks that are reasonably expected to result from the study intervention. So the first thing that you should do, and again, this is not an all-inclusive list of things that you should do. These are only examples, but you should very clearly identify what is the study intervention. Use a different heading for each of the study intervention. And for each of the study intervention, you should use a different subheading for each potential risk resulting from that intervention. And then address how you're going to minimize that risk. Now, there's no one way of minimizing risk. Every risk can be minimized in a different way. Some risks may be minimized by just putting it in the consent form and alerting the potential participants that risk may occur. Other risks may require you to have access to an emergency room in case that the risk manifests in one of the participants. They can be taken to the emergency room right away. It depends on the study. But the best way to catch every potential risk is to outline them one by one and to think through them one by one individually, again, without copying and pasting. And that will allow you to have a much more complete IRB submission. Again, this will pop up over and over. Anticipate and address other reasonable concerns that a person not in your field may think could result from the study. For example, it may be that you know that because you practice this type of science, this discipline, you know that this risk is really not likely to result. However, you know that a reasonable person will think of this risk. Don't just ignore it, because if your reviewer is from a different discipline, your reviewer is going to be wondering about that risk that every reasonable person will think about. You know the answer because you practice in that area, but your reviewer doesn't know the answer, which means that reviewer is not going to presume what your answer will be. That reviewer is going to put your protocol on hold until you contact you and ask for clarifications. And again, if there is, this is very important, cite to prior research. It shows the reviewers that you have done your research, that you know what you're talking about, and it allows the reviewers to go to one of those studies and be like, oh yeah, look, it makes sense. This risk that I was thinking about is really not something that I should be worrying about in this case. Let us look again at the MDMA study. But this time, let's write about minimizing risks. First, clearly identify the study intervention. In this case, the intervention is the MDMA therapy, not the cognitive and behavioral therapy. Notice that all participants are already undergoing CBT, whether or not they are participating in the study. So if you're writing this protocol and you clearly identify the study intervention, then you need to address only those risks that are reasonably related to the MDMA therapy, but you don't need to address the risks that are reasonably related to cognitive and behavioral therapy. Now, identify reasonable potential risks resulting from the MDMA therapy. For example, difficulty sleeping. How are you going to deal with, how are you going to minimize that risk? Explain, for example, you will provide sleeping pills, or participants will not be allowed to leave the clinic until the effect of the MDMA has subsided. There's also the potential risk for hyperactivity. Explain again that research is going to be done in a controlled clinical setting. Subjects will not leave the clinic until it's determined that it is safe for them to leave. And in this way, you are addressing, again, by using headings and subheadings, you are clear, in a clear and organized manner, addressing one of the requirements, one of the most important requirements for your study to be approved, which is that you are minimizing the risks. Again, anticipate and address other reasonable risks related to the study. Let's say that I am the reviewer reading this protocol, and I don't know anything about MDMA. In fact, I'm a radiologist, and I remember in medical school, something about people in the 90s overdosing on MDMA and dehydrating. If that is absent from your protocol, and I am your reviewer, I'm going to be like, well, what? That's all I know about MDMA. This person is not giving me any more information. And for example, that with the dose of MDMA that is going to be given to the participants, this is not a problem. And the participants are going to be kept hydrated throughout the study. Again, this is done in a controlled clinical setting. But if you don't include that in your initial protocol submission, the reviewer doesn't know anything about the dosage or the risks related to that dosage because the reviewer is not a specialist in this type of research. Another examples, can patients become addicted to MDMA? Now, if you practice in the field, you may think this is an absolutely ridiculous question. MDMA is not addictive. The dosage that we're giving is too small to create any problem on addiction, but I don't know that. All I know of MDMA is what I read in the papers growing up in the 90s in Miami, and it's not anything good about it. So the moment that I see that you are giving an illegal drug to the participants in the research, I'm like, oh my God, can these people become addicted to this drug? All drugs are addictive, right? So it is your job as the person writing this proposal to give me all the information so I can approve your protocol right away. And if you think this is not a risk, again, address it nonetheless, because it is reasonable for somebody else, not in your field, to have this concern about your study. Also, in order to receive IRB approval, one of the requirements is also the informed consent and the documentation of consent. When you write your protocol, address and design the consent process as a process, not just as a one-time yes or no question. Provide sufficient opportunity for the participants to consider participating in the study. Use a language that is reasonable for the participants to understand. If you, for example, if you go back to the MDMA study and your consent form opens with, we are asking you to participate in this study because we think that you're going to benefit from using methylene dioxymethamphetamine. That really means nothing to anyone. First, you are promising a benefit that is likely there, likely not. Second, methylene dioxymethamphetamine it's a biochemical name. I can't even pronounce that name without cracking up. Why don't you just call it MDMA? Parenthesis, the drug that people know has ecstasy. So people know, actually can review the form in a language that they can relate to and understand what they're reading. The requirements of consent, there are several requirements for the consent form that have to be complied with. For one of those, for example, or two of those, for example, are the description of reasonable foreseeable risks and a statement that participation is voluntary. Tell that statement, if you just write participation is voluntary, that is an empty statement. It just really means nothing. How about you write something like participation is voluntary. If you decline to participate, you will not lose any benefit. You can continue to be my patient. Nothing will happen to you. Something that is meaningful, relatable, and that assures the participant or the potential participant that they can say no if they want, and that there is a voluntary element to participation. There are additional elements of consent that are only required when applicable. For example, in what circumstances will you, as the PI, the principal investigator, terminate the subject's participation? Or is there any additional cost to subjects that may result from participating? If any of these things are relevant to your study, these are elements that have to be included in the consent form. And lastly, there's certain requirements for the documentation of consent form, for the documentation of consent, the actual process of signing and recording the agreement of the participant. And always keep in mind that you should be using the consent form that has been approved by the IRB. So, as a summary, if I were to give you tips for better IRB submission, there will almost all be tips related to the process of writing a clear, understandable submission. It's really an exercise in good writing. Write for a reviewer with different expertise than your own. Or even better, when you're drafting your protocol, how about you try writing for a non-scientist, which you will have to do also when you're writing the consent form. Organize your writing. Use the section 46.111 has a roadmap. It's giving you the answer of what the IRB will expect of you. Address each one of those elements separately and explain completely and clearly how it is that you are addressing those elements in your submission. Anticipate reasonable questions from the perspective of protecting the well-being of the subject. Again, the reviewer may be from a different discipline. I know I keep saying this over and over again, but it's one of the reasons why submissions get stuck in the IRB approval process, is because a reviewer from a different perspective, from a different discipline, is not given all the information in the protocol to be able to make an approval determination. Always cite reference in support of your writing. Submit a complete protocol. Include all the surveys, all the instruments that you're using. A typical scenario looks something like this. This is a minimal risk, the initial submission of a protocol, minimal risk study about studying habits in medicals of first-year medical students. There's a survey missing from the submission. So the IRB reviewer cannot approve the protocol because the survey is missing. Gets back to the PI, the principal investigator, requests the survey. Eventually the PI submits the survey. And the reviewer sees that question number 25 in the survey asks the participants if they have ever bought Adderall in the black market during finals. Also, there's follow-up questions, so the surveys also include the email address of the participant. So out of a sudden, this is not a minimal risk study anymore because you're asking about illegal behavior, and you have the identity of the participants. So without the survey, it's really impossible for the IRB to make a final determination of approval. And again, don't just copy and paste. But the most important tips that I can give you are communicate with your IRB. Call them on the phone. Go visit them. They're not there as an obstacle to your career. They're there to work with you towards what it is the shared responsibility of you as a scientist and the IRB, which is the protection of human subjects. Invite the IRB to your department for a training session. This is a training in both directions. Your department can train the IRB on research methods that are commonly used in your department, and the IRB can train your department in how to submit a more clear IRB proposal. Ask the IRB to let you sit in the meeting and as an observer. I'm not saying that all IRBs in the United States will be willing to do this, but almost always they should be willing to do this. You're just not going to be able to vote as an IRB member, but you can sit there and see how they're addressing the protocols. What are the things that they're looking at? What are the things that are often missing from the protocols? And in that way, you're learning how to write an IRB proposal through the lens of the protection of the human subjects, not through the lens of just pure scientific research. And the most important tip is don't just write to pass the IRB. Instead, write a protocol that is both scientifically and ethically sound. It is the responsibility of every scientist to do research in an ethical manner. The days of research without ethics are over, and this is a shared responsibility that we in the federal government share with your institution and with each one of you as an investigator. Thank you very much, and I can take any questions.
Thank you very much, Jaime. I think that the topic that you spoke about this afternoon is also, it's very timely for our segue this afternoon, which is really moving into having our completed research projects presented to our research community here, both from our residents and from our investigators. And so I think this is a great presentation as far as just reinforcing the importance of the IRB as a partner in the research process and why it is so important. And I really, really like how you have stressed that it is very much a partnership, that we're all working for the same purpose, and that is for the protection of those individuals that do volunteer to be participants in the studies. So again, I will just reiterate to those folks who have joined us new in the afternoon that we are taking questions using the chat function. So we will ask individuals to submit questions by just clicking on the chat box. We do have a central chat master here where all the questions will come in, so you won't be sending them out to everybody who is part of the conference this afternoon, and then we can relay them through to Jaime. And again, I encourage people to, think about questions that you would like to like to pose. Perhaps there's something that has resonated with Jaime's talk, because we do have an opportunity to, hear directly from a representative of OHRP. Maybe just while we're waiting for some questions, Jaime, one of the things that struck me as I was listening to your presentation is you were talking about, the criteria for IRB approval, and again, talking about risks that are reasonable. And of course, that word reasonable can mean different things for different people. And I know that, you have had experience both as an investigator and both as an administrator on the IRB side of things. So I just wondered if you might talk a little bit about, that word reasonable and perhaps different perspectives that individuals might have and how you find common ground with that.
Yes, sure. Regarding the requirement for approval of research, the first one is that the risks are minimized, and the risks, again, that are minimized are risks that are reasonably expected to result from the study intervention. The reasonable standard is something that we can find in every area of law, and there's no short one-sentence answer that I can give you as to what it means. It means precisely that it is reasonable. It's better understood through examples. If we look at the MDMA trial that I gave as an example, what are reasonable risks that could result from this trial? I mentioned some, for example, dehydration and hyperactivity. But when a scientist is writing a protocol submission to the IRB, it also needs to address risks that other people will think are reasonable, even though being in your field, you know that those risks are unreasonable. Because, again, the reviewer may be somebody else or somebody from a different discipline. So, for example, is it reasonable that a sociologist reviewing this protocol may be worried about overdosing, or maybe worry about people with depression having a higher incidence of substance abuse? Those are all things that are reasonable to expect somebody to raise those questions. So while in the legal sense, in the compliance sense, reasonable means something, in the colloquial everyday speech, reasonable is slightly broader, but that's what I recommend. That's the approach that I recommend investigators to take, the broader, more colloquial approach to reasonable, rather than the stricter, more scientific approach when writing a protocol to the IRB.
Thank you.
I hope I answered your question.
Yeah. Thank you. We did have a question that came in. We heard this morning from Misty about some of the proposed changes to the common rule. And the question was, can you discuss any significant changes that are being proposed regarding IRB review criteria or processes in the new common rule regulations that are being developed?
Yes, there are some changes that are proposed to the process. The IRB criteria for approval remains the same. There's a few changes that clarify meaning of certain terms here and there, but most of other changes that are not related to biospecimens that are proposed are regarding the process of IRB approval. For example, so now we have activities that are exempt, and then research that is review expedited or full board. Some of the changes create an additional category, which are called excluded. Some of what is now exempt will move to excluded, and some of what is now expedited will move to exempt. Also, the list of expedited of procedures that qualify for expedited review, if they are also minimal risk, has not been updated since like 1983, I believe, 81, something like that. One of the changes that's coming up is a commitment by OHRP to update that research every, I believe, 7 to 8 years. So there are changes that are coming up to the process, but I don't think there's any proposed changes that will directly affect the criteria for approval. And again, these are all proposals. We really don't know what, if any, of these changes will end up in the final rule or not.
Correct. Yes. Thank you, Jaime.
You're welcome.
Just maybe one last general question is, when you talked at the beginning of your presentation as far as what requires what requires IRB review slide, and the question was, can you make a comment about the distinction between, is it research, is it QI? Of course, that's a question that often comes up.
Yes. There is, if you look at the way the regulations define research, has an systematic review designed to contribute to generalizable knowledge. Often QA or QI, quality assurance or quality improvement activities, are designed to, as the name implies, improve the quality of that specific program. That is often not generalized, or simply cannot be generalized from a scientific perspective to other programs in other places. Therefore, for example, if I am evaluating the process through which my department receives complaints from the public, that may result in a document that addresses only the specific issues in my department. But it cannot be generalized to say every department like mine in the world will have the same issues, or will have this, or could improve their processes by following these directives. Therefore, the inability to generalize the conclusion makes it not comply with the definition of research. Now, the incoming changes to the regulations have tried to explain more what QI, QA, or what type of QI, QA is determined to not be covered by the regulation. Again, we don't know if this is going to pass or not. But in the actual regulations, as they exist today, it is a case-by-case determination. And one advice that I always give to people that are not sure whether what they're doing is QI or QA, or whether it meets the criteria for research and should go to the IRB, is pick up the phone and call the IRB. That's what they're there for. Talk to them, ask them, explain to them what it is that you're doing, and if you're not sure, involve them in the decision making, and that way that you get it right.
That's a wonderful response. Thank you, Jaime. And I think that it ties in really nicely with, a comment I just want to share that came in via chat as far as from one of our participants that just sums it up nicely, and it says, so the IRB office is here to help researchers. The IRB does not exist to be a wall to the execution of research. So, as you said, invite your IRB to your research meetings. They want to be your compliance partner. And I think that that's very much the message that you've given us as well.
Great. Those are very nice comments, I have to say.
So again, I'd just like to thank you very much for being our speaker from OHRP this afternoon.
Sure.
Really appreciate you sharing your perspective.
Thank you for having us.
And your